glad you're so excited.
I am so excited. What we were talking about, I had to do a replay of that. You had my head spinning. Let me tell you from my standpoint, okay? Now, from my standpoint, when I was seeing, patients back to back, anyone who had Medicaid insurance, right, would drop off our list, no show, cancel. The response was, yeah, we're going to try not to book as many of those individuals who have Medicaid. That was the solution.
What an awesome solution to turn away people who have asked for our help. Think about that. They called the office. They said, I want to get scheduled. And then they didn't show up. Whose fault is that?
We blame the person, right?
Every time.
Like every time.
With zero control for, as in research or a survey of going, what were they paying for? When's the last time, right? I think I use this example. I mean, when's the last time someone showed up somewhere, right? I mean, think about the thought and the conversation that goes into where do you want to go to dinner, right? Between the food, the cost, the parking, the commitment, and then we say physical. Oh yeah, we got you scheduled for physical therapy. Okay, what's physical therapy, right? We got to do a better job making sure people understand. I talked to Dr. Jason Sharp a lot about this, who's done research in this, a PT, PhD. And, we got to do a better job making sure under people, when they hang up the phone, they know what they're investing in, their time, their money, their energy, right? Mm-hmm. And so this is my whole thing. There was a huge study that came out of Ohio State, maybe a year and a half ago. Their huge program, which I loved. So they had a lot of info to draw from. And I remember seeing it posted and I got all excited. And I actually had to talk myself down before I opened it because I was so excited to see, why are people canceling? I mean, this is my work, right? I help prevent cancels. And I went, okay, don't get excited. Don't share your biases, but this is probably what the results are going to read. And I think I guessed right on 3 of the 5 results. And it's the same thing. The people most likely to not show or cancel a first visit for PT, the standard stuff, Medicaid, lived more than 5 miles away. Female was in there. I think I told you that. And I don't remember the other 2 because it didn't really matter to me at that point, because I went, it's telling us the same thing. So all these very bright, intelligent business people will see this research and go, cool, we're not going to schedule people on Medicaid because they cancel. We're not going to schedule people who live more than 5 minutes away. It literally, it's 5 miles. Sorry, 5 miles.
5 miles.
I'm like, how shitty is your service that someone wouldn't even go 5 miles for it? That's the way you should be looking at it, right? But again, this whole idea of it told us who's canceling, not why they cancel. So if you get a person with Medicaid, right, you should be telling everybody the value of what you can deliver.
Yeah.
But if I saw one of these 5 higher risk people, am I spying? By the way, if I spend 5 minutes extra on the phone call to get someone to show up, is that a good investment?
Yeah. But Jerry, what sense does that make? My background is in pelvic health and women's health. I'm seeing women within the first few weeks after birth, after major pelvic surgery, and the solution is to not accept the largest population that Medicaid covers, which is the maternity population.
Wow, really?
Oh yeah. Medicaid is the highest payer for maternity services in this country. And so that would be the solution, to turn those people away. There must be something on our end. And that's when we spoke, you were blowing me away. Like, you were saying, don't set up a practice and call it physical therapy if you're not explaining what physical therapy.
Go down that route. Yes. So this is what's interesting, right? And by the way, I think I've done more posts since that. I did a post the other day that said, just FYI, your scheduling, just get everybody scheduled mindset is creating chaos. So you actually created, you the business owner, you the manager, you the person in charge, have created the chaos in your business of no shows and cancels because you don't understand the process. And you just tell Rebecca, Jerry, just get everybody on the schedule. Well, what happens when the Medicaid people, the people who live more than 5 minutes away, the women call? Well, we've cut down the number of slots. So just give them the available slots. If they don't take them, don't worry about it. I'm like, wow. I mean, literally, that's the way it goes. So we say, right. So I'm big on impact, potential impact and risk. And I'm like, right. So the group you just described, I think there's huge potential for change there, right? I mean, it's not very difficult to make change in that group because they want, I mean, they're there, they want it. It's a huge group of people, right? If I'm going to start a business, that's actually the business I'm going to do the work to start, is to serve those people. I tell people every day, if I could start a clinic today, it'd be a women's pelvic health clinic.
Really?
Because I think the impact, the potential and the impact can be so big. So we take this group and someone says, oh, but Jerry, all the women in this area who call for pelvic health or Medicaid, I'm going to go, by the way, you know, the first question I'm going to ask, cool, how many other people take it in the area? And you're going to tell me nobody for 50 miles. And I'm going to go, oh, fuck, let's open it tomorrow. We're going to make this work.
Right.
And by the way, we're going to invest. And here's the kicker that I want everybody to hear. Everybody thinks, great. All right, I found Dr. Rebecca Seagraves. I've got the best pelvic health physical therapist in the whole state. And she brought 2 other people with her. I'm going to build a whole business around these 3. And then I'm going to hire some people to answer the phones. I'll hire some people to do billing. And we're going to put a fancy name on it. And I'm going to do all this marketing and tell everybody to send all our patients here. And then what happens when they call? We manage it the same way.
Right.
We don't give people, here's my thing with cancels. Instead of coming up with cancel policies, come up with reasons. So we always spend time figuring out how to punish people.
Yeah.
I said, how about we give them a reason to arrive? How about we learn a little bit more about them? How about we find out and ask the questions pre-arrival of what might keep you, what limits?
Childcare, right?
So Becky, tell me, so how are things being? So I'm going to build this business, by the way, and invest in spending 15, 20 minutes on the phone with every single new client, right? Everybody goes, those calls are too long. I'm like, too long for what? To get a happy paying person in your office? How much is, I love this all the time. How long should I spend on the phone? I always say only as long as it takes. And there is a basic structure for how to manage this. Don't get me wrong. This isn't just get on the phone, make friends with everybody and they'll show up, because they won't. They'll be friends with you and they'll want to be friends with you and they'll want to meet you. But we didn't sell, bear with me on the terminology, the value of arriving, by the way, now finding daycare. We had this discussion. Now finding daycare. Now telling your work you're going to be an hour late after, there's probably a little tension because you went out on maternity leave in the first place.
Exactly. Yeah.
And now tell work you're going to be late every day, twice a week for the next 4 weeks because I'm going to physical therapy. Stack up everything on that. And then we listen to that and we hear that and we help manage and set expectations around that. So that person, all I want when that person hangs up the phone is to go, wow, I picked the right place. And if we do that, you think they're going to show up? You think they're going to make
absolutely.
Right? All those things. So again, if you told me you wanted to set this up and you said they were all Medicaid, I'd go, cool, what are they paying? Cool, how many other clinics? And you tell me nobody within 50 miles. And I'm like,
no competition.
can we open yesterday? Yeah, can we open yesterday?